how do you fully assess patients before a blepharoplasty procedure?
It's very nice and very important question really, because it needs a very experienced surgeon. There are 5 things the surgeon has to differentiate and assess fully before considering the correction of the skin around the eye. The first thing we need to identify, is it eye bags, fullness around the eye? Is it excess skin? Is it wrinkles or line? Or is it really the ptosis of the eyebrow? Or is it the lateral cancers, the lateral corner of the eye depression? So all these things has to be fully assessed before surgery. Let's start with the eye bags. The eye bags caused mainly by the collection of fat in the upper eyelid and lower eyelid. This is most commonly seen in younger patients. Patients usually from the age of 20 may have this issue because it's a hereditary, it's a familiar issue, it runs in the family. So therefore we very frequently correct the eye bags and the fullness around the eye in young patients between the age of 20 to 35 up to 50. Now the second issue it could be both the fullness and the eye bags plus the redundant skin. So patient may have both a fat and redundant skin. In this case we have to remove the fat and also excise this excess skin or redundant skin from the upper eyelid and also from the lower eyelid. The third case, which could be actually mainly not redundant skin, confused. This is very confusing. Maybe the problem is mainly the wrinkles, the line, and the eye folds in the lower eyelid mainly and on the side of the eye. This is very confusing and many surgeons treat this by surgery. This cannot be treated by surgery. This should be treated mainly to treat the skin by either doing skin resurfacing mainly. Skin resurfacing can be done either by the fractional laser or by the chemical peel. Plus Botox to reduce the line, because this line is also caused by the hyperactivity of the muscle around the eye. So this skin condition which has got no excess skin, which is mainly the wrinkles, fold, and the line, is treated by conservative, by peeling and by Botox. The fourth condition, when what you look to the patient or the surgeon will examine that, I mean the excess skin there, mainly in the upper eyelid and the hooding in this area, is mainly caused by the ptosis of the eyebrow. It's not caused by the excess skin. So in this case, when the surgeon put his eyebrow slightly like this, he will see that the problem disappears. So in this case, if the surgeon has got no much experience and removes the excess skin, the patient will not benefit and will end with deformity. So the answer for this condition with the hooding and ptosis of the upper eyelid and eyebrow is to do the eyebrow lifting, and combined with forehead lifting by small cuts behind the hairline, hidden behind the hairline, not obvious skin cuts. So this is the surgeon will access from there, go under the skin and under the muscle to this area, elevate the muscle and the skin and suture it back to the skull there.
So what I understand from you is that different
there's still one more case when patient has got a low lateral corner of the eye compared to the medial corner here. So this case usually can be either congenital or due to aging. So in this situation, we can also help the patient by trying to elevate the corner of the eye slightly, as much as possible, by ligating the ligament which connects the eye there, the eyeball there to the bone. This ligament is anchored and suspended to the bone of the orbit there. This also can be done with the blepharoplasty procedure. So all these conditions have to be assessed fully before surgery, and the surgeon has to really identify exactly what's the problem. Is it eye bags only? Is it eye bags with excess skin? Is it only skin wrinkles and line? Or is it the ptosis of the eyebrow which is giving the impression of the fullness in the upper eyelid? So that's very important. The accurate diagnosis lead to is the best outcome and patient satisfaction. I hope you fully answered your question.
Yeah, so I understand that there isn't a one-size-fits-all method or procedure. According to the findings, you cater your procedures, your treatments.
What we find with patients, many patients who have the blepharoplasty by, surgeon with lack of experience, especially the people who come from Iran and from Turkey. You find really, severe morphological deformities with their eyes. And very abnormality, which you can just straight away look at the patient and see what he did for his eyes, what he has done. He has done blepharoplasty. Now the new concept of preservation. New concept is that you have to be you, not somebody else. It has to be your eyes. So it's conservative removal of the fat, conservative removal of the skin, conservative management of the muscle under the eye. Everything has to be conservative. You just have to remove very little.
The bare minimum.
Only the excess, and keep the eye looks natural, looks normal. Not overcorrection, no overcorrection. Okay.
All right, thank you so much for your time, Dr. Bashar.
Thank you very nice. Thank you very much.